Hello, family and friends. Today we'll finish the discussion about contact lens health and focus on how to mitigate your risk of developing an eye infection. Many people who wear contacts are not sure about how to use them correctly and care for them correctly. So take a listen to these important tips. Number one, do not sleep in your contacts because it can increase the risk of infection by 8-fold. Number two, wash your hands with soap and water before handling the lens and dry your hands before handling them as well. Number three, keep your contacts away from water because it can lead to an infection. That includes no showers, hot tubs, steam, sauna, or swimming with contacts in your eyes. Water and contacts do not mix. Number four, rub and rinse your contacts first. Then store your contacts with the solution prescribed by your eye doctor. The most common solution used is a multi-purpose solution because you can clean, rinse, disinfect, and store your contacts. Number five, never wear your contacts if they have been stored for 30 days or longer without re-disinfecting them. Number six, never rinse or keep contacts in water, and that includes tap water and sterile water. And number seven, which seems obvious, but I have seen people do this. Never use your saliva to re-wet your contacts. It is not sterile. Number eight, do not use saline solution or re-wetting drops to disinfect your contacts. And never use homemade saline solution. They are not disinfectants. Number nine, get rid of the old solution left in the contact lens case before refilling it. Number 10, keep your contact lenses case clean. The case can be cleaned with your multi-purpose solution. Make sure all the debris from the inside and outside of the lens case has been removed. Allow the case to air dry on a paper towel with the lens case facing downward. Number 11, replace the contact lens case at least every 1 to 3 months. However, I believe it is safer to use daily disposable contact lens, especially if you do not have time to properly clean and care for your contacts. And lastly, for those of us who wear makeup, here are some additional essential tips. Number one, insert your contact lens first, then apply your makeup. Number two, apply makeup on the outer lid of the eye and not on the inner aspect. Number three, remove your contact lens first, then remove your makeup. Number four, use a fragrance-free and oil-free hypoallergenic makeup remover. Number five, use a non-oily mascara and do not use mascara that has lash building fibers. Number six, make sure you replace mascara and eyeliner approximately every 3 months to decrease the risk of contamination. Number seven, if you happen to get makeup on your contact lenses, clean them right away. Number eight, do not use frosted, glittery types of eyeshadow. These can flake and cause eye irritation and infection. Number nine, and don't use loose powder to the face. Choose pressed powder instead. I want to end by stressing the importance of hand washing. It is the first essential step in the fight against eye infections. Well, that's it for today's tips. If you have not already done so, please check out the link in the chat. See you next Tuesday.